HIPAA Training, Part 2.
As discussed earlier, when disclosing PHI, you must record it in the patient notes. This should include date, what was sent, to whom it was sent. The patient can request to see this information for 6 years. These disclosures are outside of TPO. Patients also have the right to request that you give special treatment to their PHI. Medisave does not have to agree to do this. This type of request must be in writing. Again, this must be handled very carefully by your supervisor or privacy officer. Patients also have the right to request confidential communications. Be considerate and speak quietly to patients. Make a reasonable attempt to move them away from others for consultation. Don't just assume a patient does not mind if you talk openly about his or her PHI. That means if a patient wants to speak to you in private, you must accommodate. Take them to an area away from staff and other customers where you can talk to them. Patients have a right to complain if they feel we have violated their privacy. We have a form for the patient to write his complaint to us, or he can complain to the Department of Health and Human Services. We hope they will complain to us and give us the opportunity to resolve this issue, but this is their choice. The written complaint should be given to your supervisor, and a copy should be forwarded to the privacy officer. Do's and don'ts on patient rights. Do give patients copies of your organization's privacy practice. Do ask your supervisor for advice if a patient wants to make changes to his or her records. Do let patients know that you can consult with them in a private area if they prefer. Don't tell patients they can't see their medical billing records. Don't automatically grant a patient's request to restrict the way you use his PHI. Don't let patient complaints get out of hand. What to do if you make a mistake? Don't panic. Notify your supervisor immediately. Explain how it happened, why it happened to the best of your knowledge. Reflect on the situation and come up with suggestions for ways to correct this problem and learn so it doesn't happen again. Make a report on the incident report sheet and give it to your supervisor. A copy should be sent to the privacy officer. Business associates are entities or individuals that perform a function or activity for Medisave home care pharmacies and have access to PHI and are not employees. We require these people to sign a business associate agreement. They are then required by law to protect our customers' PHI. These include, but are not limited to, the following: delivery personnel, computer software or hardware personnel, companies who drop ship medical supplies direct to our customers, salespersons that are in protected areas, any other person that has access to our customers' PHI. Electronic PHI. This refers mainly to your computer. All computers are password protected. You must keep your password to yourself. Do not share your password with anyone. Computer screens should be turned as to not be easily viewed by customers. When away from your desk, be sure to turn off your computer screen. When employees leave the employment of Medisave, their passwords will be deleted. At the end of the day, Medisave employees should close all applications and log off their computers. Hard copy PHI. All RX labels with any patient information and used labels must be shredded. Reports with PHI must be shredded or stored in a safe area. Working papers on desk, including charts, must be turned over when left unattended. Computer screens must be turned off if left unattended and are in view of customers. Fax machines, copiers, and printers outside of the protected area must be monitored closely. Delivery tickets need to have the minimum amount of information showing. Backups should be done nightly and kept in a secure place for protection of PHI. Verbal PHI. This includes face-to-face conversations and phone conversations. Take customers to the side and discuss their PHI a reasonable distance from the counter and other customers. Speak quietly when discussing PHI-related details with other workforce members, patients, and authorized individuals. Make a reasonable effort to conduct PHI-related phone conversations in a private area, such as a licensed area, and speak quietly. This also includes when listening to your voicemail messages. Make sure that other customers are not within earshot of your voicemail speaker. If so, pick up your handset and listen that way. When leaving messages for patients, do not leave detailed information. Just leave your name, that you're with Medisave, and ask that they return your call. When paging customers back to the pharmacy counter or the customer service area, use last names only. At the drive-thru area, speak face-to-face with the customer. Make a reasonable effort to protect their PHI. Physical access. You must make a reasonable effort to safeguard Medisave from intrusion from unauthorized individuals. There are areas in each location that are protected or licensed areas. These areas are off limits to all non-employees, with the exception of business associates. Any area that is labeled employee only is for employees only. That is behind checkout counters, behind pharmacy counters, or in the pharmacy area. Only authorized workforce members possess keys to the pharmacy and alarm codes. Only employees are allowed behind the pharmacy counter and licensed area. Do not leave the protected area unattended. Remember, employees only. No family, no friends, no former employees. We need everyone to cooperate on this issue. It is unfair to put your coworkers on the spot when you do not comply. This is one area that will produce complaints quickly, and it will usually come from a customer or another healthcare worker. Remember, it's usually not what we say, but how we say it that causes problems. A copy of Medisave Home Care Pharmacy's HIPAA policies and procedures is in the pharmacy area of each store and in DME. It contains copies of the various forms you will need. Please read it and refer to it when necessary. Thank you so much for your cooperation and support. All questions should be followed up with Jamie Smaltz, our privacy officer. Congratulations! You have now completed both video portions of the required HIPAA training. You are now ready to test your HIPAA knowledge.